Good evening, class. My name is Flora Okeke. We are going to finalize this class, Foundation of Nursing I Hcm 115. In our previous lecture, we stopped at evaluating and putting on paper. That is, for Foundation of Nursing, purpose of nursing care plan. Today, we are going to discuss nursing diagnosis. Nursing diagnosis. Know the concept behind written NANDA, nursing diagnosis, in this ultimate historia and nursing diagnosis list, now update for 2021. Learn what is nursing diagnosis, its history and the evolution, the nursing process, the different types, its classification, and how to write NANDA, nursing diagnosis, correctly. Included also in this guide are tips on how you can formulate better nursing diagnosis plan, guide on how you can use them in creating your nursing care plan, NCP. What is nursing diagnosis? A nursing diagnosis is a client, or a nursing diagnosis is a clinical judgment concerning human response to health conditions, stroke life, process, or a vulnerability that helps to respond or responses by individual, family, groups, or community. A nursing diagnosis provides the basics for the selection of nursing interventions to achieve customers or outcome for which a nurse has accountability. That is something that nurse can give account, something that nurse can answer. Nursing diagnoses are developed based on data obtained during the nursing assessment, that is information, raw facts, and enable the nurse to develop the care plan. Enable the nurse in form of personal data, individual patient personal data. Purpose of nursing diagnosis. The purpose of nursing diagnosis are as follows. It helps identifying nursing priorities and help direct nursing interventions based on identified priorities. That is based on observation and findings. It helps to formulate, secondly, it helps to formulate in terms of formulation of expected outcome of quality assessment requirements on third parties there. That is quality assurance. In this respect, quality assurance and quality control need to be applied. Nursing diagnosis helps to identify how clients or group of respond to actual or potential health and the life process, and they know their valuable response for strength that can be drawn up to prevent and or resolve problem. In this respect, is talking about how create the group of potentials and how to, in form of organizational structure, the organigram, how the problem will be solved, so that patients will be also be able to help himself or herself. D. Provide a common language and form a basic for communication and understanding between nursing professionals and healthcare team. That is common language in a best way that everybody needs to understand. In nursing parastatal, with times you see that they have some terminologies used that they are normally used, more especially when writing drugs. Doctor's handwriting, we are calling it doctor's handwriting. Good. E. Provide a basic evaluation to determine if nursing care was beneficial to the client or cost effective. To provide basic evaluation, that is to find out, to know that whether nursing plan is beneficial to the client, that is to the patient, or cost effective. Nursing care plan in form of for nursing students, nursing diagnosis are an effective teaching tools to help sharpening their problem solving in form of problem solving skill approach. Critical thinking need to apply. A nurse need to think critically before applying any method because of what? Because nurse are like second God after God. Differentiating nursing diagnosis, medical diagnosis and the corroborative problems. Need to differentiating nursing diagnosis and the medical diagnosis. The one that nurse can find out and the one that efficacy of drugs can help to find out. At times, doctor will send somebody to the lab. It's because of this diagnosis to be able to find out and know the appropriate solution. The term nursing diagnosis is associated with nursing with three different concepts. Nursing diagnosis is associated with three different languages or three different concepts. It may refer the distinct second steps in the nursing process. Diagnosis also, nursing diagnosis apply to the label when nursing assign meaning to collect data appropriately labeled with NAND. 1. Approve nursing diagnosis. For example, during the assessment, the nurse may recognize that the client is feeling anxious, fearful, and find it difficult to sleep. In this respect, nurse be able to find out the problem of the patient. It is for those problems which are labeled with nursing diagnosis, respectively anxiety, fear, and disturbed sleep pattern. Whether the patient are able to sleep well or one thing or the other. You see that in nursing diagnosis, the nurse may be able to find out because during the evaluation, nurse needs to ask questions to the patient. Ask questions to know what to do at the right time. Lastly, a nursing diagnosis refers to one of many diagnoses in the classification system established and approved by NANDA. In this context, a nursing diagnosis is based upon the response of the patient to the medical condition. That is the efficacy of drugs, how the drugs works immediately or after, to know how the patient feel about it. It is called a nursing diagnosis. Good. Because these are matters that hold a distinct and precise actions in that issue. The diagnosis. When you look at this diagram, you see the nursing process. Nursing process. Number one is assessment. Nurse needs to assess the patient to find out some things, to observe some things. Diagnosis. Nurse needs to examine, diagnose, know the efficacy of drugs, whether it works or not. Planning. Nurse need to plan in terms of booking appointments. Not like drugs. There are some drugs that used to take for six hours. There are some drugs that you need to take, that is in terms of monitoring, planning. The other one, implementation. You need to implement. The other one also, evaluation. Ask questions to know how the patient feel. Problem focus nursing diagnosis. A problem focus nursing diagnosis, known as actual diagnosis. It's known as actual diagnosis. It's a client problem that is present at the time of the nursing assessment. The problem of the client, that is patient. These diagnoses are based on the presence of association signs of symptoms to be able to note how the patient feels. Actual nursing diagnosis should not be viewed as more important than risk diagnosis. There are many instances of where a risk diagnosis can be the diagnosis that is the highest priority for the patient. Problem faced nursing diagnosis have three components. There are three components of problem facing nursing diagnosis. Number one, nursing diagnosis. Two, related factor. And three, defining characteristics. Examples of actual nursing diagnosis are ineffective breathing pattern related to pains and evidence by pursued late breathing. This is talking about how patient breathes. At times, when you check the patient breathe, there are the one that is bad breath. That's why at times at hospital they need to put in oxygen in order to support their breathing. Report of pains during what? Inhalation, use of necessary muscular what? Breath. This is one another systematic approach in which we use to save lives. We use to monitor them, evaluate them, ask questions to be able to know the types of drugs we are going to give them at the right time. Anxiety related to the stress as evidenced by increasing tension, apprehension and depression of concerning regarding of upcoming surgery. For example, anxiety. You may even tell somebody that you are going to have surgery, which is operation. The person may even have fear, tension. That's why you need to check their blood pressure before entering the theater for surgery. Because at times, the equipment alone, the infrastructures that are there, will invoke fear in them. That's why you need nurses and the other people surround need to encourage the patient that and give the patient quality assurance that nothing will happen to the person. Actual pain related to the decreased myocardial flow. Myocardial flow as evidenced by remitting extension of pains and then grinding behavior. This is talking about pain. When somebody is in pain, the person can even misbehave. But after that pain, the person may get him or herself normally again. Examples of all these pregnant mothers. The time they are in labor, they can even act as mad person. But after that, they may even recover themselves very well. Implied skin integrity related to pressure, overburning promise as evidence of by pains, bleeding, redness, wound damage in terms of pains when somebody have an injury, more especially people that have accidents or bleeding. As I said before, there are how things will be. It will cause what? Terrible pains, which is what? Implied skin of what? Integrity related to the pressure of what? Bony promise. Risk of nursing diagnosis. Risk nursing diagnosis. The second type of nursing diagnosis is called risk nursing diagnosis. These are the clinical judgments that a problem does not exist, but the presence of risk factor indicates that a problem is likely to develop unless nurses intervene. in this respect unless nurses what? Intervene. That a problem must need to arise unless nurses intervene. You may even see somebody that's unconscious. You see that without intervention of a nurse, the person may pass on. There are no etiological factor, related factor. Etiological factor means related factor for risk diagnosis. The individual or group is more susceptible to develop the problem than others in the same or in the similar situation because of risk factor. Examples: an elderly client with diabetes or vigor has difficulty walking, refused to ask as assistance during the ambulation may be appropriately diagnosed with risk factors for injury. This is talking about those that are having diabetes. We know diabetic patients don't need to have injury because when they have injury, see that injury may not go on time due to that they are diabetic, so they need to be monitored very well. Components of risk nursing diagnosis include risk nursing label and risk factors. Examples of risk nursing label are risk for fire as evidenced by muscular weakness, risk for injuries as an evidence or likely mobility, risk for infection as an evidence by immune suspicion. This is by infection. This is talking about environmental factors depend on the type of environment. That is, in terms of epidemiology, it may even affect the skin. Health promotion diagnosis. Health promotion diagnosis, also known as wellness diagnosis. Wellness is a clinical judgment about motivation and the desire to increase well-being. Health problem diagnosis is concerned in individual, family, community, transition from specific level, as well as a higher level of wellness. Remember that what we are talking about is what? Health promotion diagnosis. And remember that we have health promotion diagnosis, we have risk nursing diagnosis, and so on and so forth. Remember them. Also, when you look at this diagram, see types of what? Nursing diagnosis. As I said, you see problem focused. In this problem focus, you see inflection, you see different in breathing pattern related to decreasing lungs. It depends on how that person breathes. The risk, the second one is risk. Risk for what? Inefficiency airway. Risk when somebody is not breathing well. See risk. Health promotion syndrome and the possible. There are other things we need to know. Component of nursing diagnosis. Nursing diagnosis have typically three components: the problem and its definition, the ethical and the defining characteristic of risk factor (brackets for risk diagnosis). Component of NANDA. 1. Nursing diagnosis statement. You look at the diagrams, you see the examples, problems of definitions too. When you look at the problems of definitions too, a lot of things. The problems of statements or diagnosis level describe the client's health problem. In this respect, see the client, the age, the name, the type of sickness. You may even look at the folder. You see, be able to dictate a lot. A diagnosis level usually have two parts: qualifier and the focus on diagnosis. Qualifier, also called modifier, and words that have been added to some diagnosis level give the additional meaning, limits, or specific with the diagnosis statement. Examples. There are examples of what I'm saying. When you look at this, we see anxiety, that is weakness, nausea, and so on and so forth. Here is the qualifier. or focus are inherent in the one thing. Look at the example.